Hello, my name is Brian Casey. I'm editor-in-chief of AntMini.com, and we are here at the conference on machine intelligence in medical imaging, sponsored by the Society for Imaging Informatics in Medicine. We have with us right now Dr. Bradley Erickson. He is with the Mayo Clinic. And Dr. Erickson, thanks for being with us today.
Thank you, my pleasure.
So we talked just recently to Dr. Elliot Siegel about artificial intelligence in radiology, and you've also, with Dr. Siegel, have been pretty instrumental in putting the program together here at this meeting for the next couple days. So I'm going to ask you some similar questions, and maybe you'll have a different take on his. What do you see? What's the current state of artificial intelligence in radiology to you? Do you see some of the early barriers that were being experienced? Are radiologists starting to overcome those things?
So I think at the start there was a lot of utter disbelief that computers could have any significant role, and part of that is because early experience with computer-aided diagnostic tools was pretty unsatisfying.
Sure.
And so just a lot of jaundiced view of the potential of computers. And I think that now people are starting to see that there's a lot of potential there, and a lot of it was couched as man versus machine, and I think now people are starting to say it's not so much man versus machine, but how can computers help me do a better job? Some people are starting to use the term augmented human intelligence rather than artificial intelligence to emphasize the fact that this is about making us do better and ultimately take better care of patients, not about replacing somebody.
Right, exactly. So radiologists are starting to see AI as a partner as opposed to a competitor.
Yes.
Yeah, that makes a lot of sense. Now, we saw a lot of sessions this morning, Sunday morning here at this meeting. What were some of the things that kind of really piqued your interest, that got you most excited?
So one thing that I'm always impressed with is how much this sort of technology seems to be more limited by creativity and new ideas, as opposed to traditional CAD is, I'm going to try to make this diagnosis. So there was one that was looking at how to give feedback to technologists so that they don't run the CT scan through the lens, because there's a known risk with that. And just that creativity of, oh, I bet this technology could help me with this problem. So I think it's just the incredible flexibility and generalizability of deep learning technology has allowed us to apply this in ways that is really limited by imagination and not the traditional, this is the sort of task that radiologists want to do.
So it's going beyond, it sounds like the applications for deep learning go beyond just analyzing images.
Yeah, I think there's an awful lot of interest in how can we do our job better, and that includes not only diagnosis, but how do we get better workflow? How do we make sure that the right cases are read in the right way? How do we pull the information together as effectively as possible?
And that's the augmented part of,
Yes.
of AI. Now, it sounds like radiology and radiologists have overcome their initial opposition or skepticism of AI, but there are still some barriers to it being used in clinical practice, and it's really not being used in clinical practice on a widespread basis right now. Is that correct?
Yeah, that's fair.
So what are some of the things that we need to do to get to that point?
So I think there are a couple of hurdles that we need to look at. We can publish good results in scientific papers, but ultimately it's a matter of trust. We have to get the trust of the physician saying, yeah, this actually is going to give me good results. And that's more than just a p-value in a paper. I think what some are terming explainable AI is a critical component that can we look at the network and see that it is making rational decisions? So for instance, heat maps that say, I'm looking for pneumothorax, and yes, it's finding the pneumothorax in the right area of the lung. It's not finding a chest tube reflecting treatment of an already detected. So I think having better levels of trust is critical, and tools that can explain what the algorithms are finding is critical. And then also just better workflow. Again, too many CAD algorithms were an additional task rather than replacing work that we do, and that is not going to work. We have to figure out how to make sure that the right images get to the analytical tool and the results get routed to the radiologist in an efficient manner so that they don't have to go and click extra buttons to send it out, that everything is right there and presented to them and ready to run.
Do you think that CAD is widely seen in radiology as being kind of disappointing in terms of how it sorted out What do you think, are there similarities and are there differences in terms of how you think AI is going to turn out?
So I think that there's some exciting possibilities. A lot of the tasks that have been applied, that AI has been applied to, had been to replace the radiologist. Can I detect this disease, or can I measure this? I think one of the really cool things is that we're starting to see that these technologies can find things that are not humanly possible. So some of the work in my lab and other people's labs have shown that we can predict genomic and molecular level markers from images that humans simply can't perceive. And I think that that ability is one of the really exciting things that has got to make radiologists excited about doing these sorts of new tools, because that really significantly increases the value of radiology to the care of patients.
And that's another example of how AI goes beyond just reading
Yes.
the images, which is kind of what CAD was always restricted to.
Yep.
Good.
Yes, exactly.
All right. Well, I asked Dr. Siegel about what he was expecting at RSNA. What are some of the things that you're looking forward to at RSNA this year?
So I think clearly there's going to be a lot more emphasis on workflow and some of these other types of tasks that we need to do, and using artificial intelligence to really improve the quality of care. I'm sure that we will see a lot of the same posters of doing the same sorts of tasks that radiologists do, but I think also this concept of finding what it is that the network is seeing is really kind of the next major swirl of activity in the scientific realm. Is, what are the networks seeing, and what can we harvest from that in order to make science better?
Okay, perfect. Well, thanks for being with us. If you're watching at home, please, and you're in the San Francisco area, please swing down Sunday afternoon, or Monday. We're at the Hilton close to Chinatown. And thanks everybody for watching.
Thank you.